a lot of time, care is always the last thing on our list in terms of who is actually going to do the work. We know we need it to in order to go get our work done.
Yeah, care is perceived as the lesser or the weaker chain of care support.
We all need care at every point in our lives, whether when we're born or throughout our lives or even towards the end of our lives.
People don't know that this care thing is so serious to the point that you will lose focus if you are not methodical about how to go about it.
Our people are badly behaved. The minute they see that somebody is a helper, especially when they're helping the elderly ones, the minute they see that, it's like anything goes. They start, the insults start, the disrespect.
Yes.
We start to really embrace this idea that care is a life skill.
Yes.
It is a technical skill. It's a professional
I
skill.
even tell people it's the universal language. It is important that we need to place value on care. And to place value on care is to place value on oneself.
Welcome to the Homefront. My name is Adesiyan, founder and CEO of Caring Africa. And I am here today with my wonderful friend, Abiola Ayilara, CEO of MyQura Assistant. How are you?
I'm very well, thank you. And thank you for having me, Blessed.
I'm so excited to have you. In fact, it's been
excited.
So tell us about yourself, because you wear many hats, in my own opinion. I don't think you know this. And a lot of people don't know you, but I'm here to say that you are a big deal in this Lagos, in this Nigeria.
I think you're exaggerating.
No, I'm not exaggerating. Because even before I met you, so many people were like, are you sure you've not met Biola? I'm like, no. Like you go and meet her. She's doing a lot of things around care. And I'm like, there's somebody doing care in Nigeria. Oh yeah, please, let's talk. So tell us about you. Like, who are you and how did you come about the work you're doing now?
Right. So thank you very much for having me once again. And I would say my journey started since it's been over 18 years now, right? I started off as a nurse in training. And I know that then, we were thought to be very compassionate, that posterity would judge us if we don't do the right thing. So, having the right culture, the right mindset, and the right attitude to care is something that I've carried within me for a very long time. So, relocating abroad, getting the care experience over there as well. With what I've learned in Nigeria, I was able to, see a clear difference in care across, the globe. And that has actually influenced what I'm doing today. So for me, care is something that, like I said before, is something that is ingrained, is nurturing, it is fulfilling. And I love to see people get well. I love to see people get better, especially people that are vulnerable. And that is my passion. That is what I brought into MyQura Assistant, quite a lot. So, but it's been a journey and we're still on that journey.
And, I think one of the things that, drew me to you was just how professional you were. I don't know what they teach in nursing school, because there's just this professionalism.
Right.
And, for a long time, when we think about care on the home front, right, not care in a traditional, healthcare setting, in a traditional hospital, we don't think that it's professional, right? We always assume that it's not just to take care of daddy and mommy and the children, or is it not just to support? Why does this require any kind of professional skill?
Yeah.
So I think that was what drew me to you, was just how methodical you were in terms of looking at the data, the evidence-based research, following the science and saying, how can we make care better here in Nigeria? And that was something that I had never seen in this environment before. So let's talk about the traditional Nigerian family, because in the past it used to be that our parents aged at home.
Right.
Like it used to be that, I remember my grandmother, may God bless her memory, but she passed away, I think around the age of 90 something, close to 100.
Nice.
And I just never, she was always around. We were always taking care of her, or there's another family member that was taking care of her, and it was a non-issue. And then my dad got sick, and I was like, suddenly we had to scramble for care, right? Because I'm out of the country, my sister is out of the country, my brother is far away from home. Luckily, I had two other brothers that were home, so they were the one who stepped into that caregiving role,
Right.
with my stepmom at the time as well. And that was when I realized just how complex care is. right? Especially for our elderly people, those with chronic conditions. How are families meeting their care needs right now? For example, if you have an aging parent that needs care, how are we doing it now in today's environment? What are the challenges?
I think we should. Thank you. I think we should begin from the journey. I mean, the story you've just given us now. You would agree with me that that informal care culture has always been there. It is ingrained in our culture, especially in Nigeria. We care for people from a familiar perspective. You know, we have this communal sense of responsibility towards each other. So my neighbor has got a child, I can also help train that child. You know, I think this is where we got this it takes a village to train up a child and all of that. And then as we grow older, we have people also aging. But I think what we did not really put into perspective is the fact that we forget that as we age, so also is modernization coming to play. So we now see people moving across the globe for, for their own what's the word now?
Opportunities, yeah.
Opportunities. You know, they are trying to make meaning with their lives. They're becoming more adventurous. And you would agree with me that now we have more growing youth population as compared with 10, 20 years ago. So you see that people are getting many skills that needs them to go away from home. And somehow the responsibility of care for our aging people is left at the mercy of literally nobody except what is readily available.
Correct.
And then you start hearing about domestic staff and all of that. So the challenges for me would be the fact that there has not been any blueprint to say that, okay, in the next 10 years in Nigeria, we're going to have the population of the elderly people is going to double. So by virtue of this, there's a need for us to put XYZ in place. So that XYZ that is not in place is now the gap that we are trying to fill. And then it appears like it is difficult for people to accept this solution because they're seeing it as, is it really a need? Is it really important? Why would why do I have to get somebody to care for my mom? I can do it myself. But we forget the fact that we put this burden upon ourselves,
Mostly women.
especially women, without considering the impact on us as a person, on the family that we are building, and the future that is actually coming. So you would see, I mean, I've had lots of stories of people that we are currently supporting. They would come and then they would talk about how overwhelming it is for them to support their loved ones, how some people have had to resign from their work just so that they can focus on their mom or their dad. And they have this sense of guilt to say that I want to be the one to do it. Nobody else can take care of my mom because it was my mom that gave birth to me. It was my dad that gave birth to me. They sacrificed for me. And because of that, I want to be the one to care for them. But I think if we begin to have a change in perspective around the way people think about care, they begin to realize that this is more of a burden than a sense of responsibility or duty of care. Because guess what? You can care for your loved one with or without you being present. You know, we've had cases where a family member, no, sorry, a child said ever since she got married, she hasn't gone on a holiday with her husband before because she's been caring for her ailing mom. And when they came across my care assistant, they got the care support. And for the first time in years since they've got married, they've had to have a holiday.
Wow.
And they didn't have to worry about the fact that, oh, what's happening to mom? Because they get the reports daily to say that, oh, mom is well cared for. They could see from their CCTV that she's well supported, she's having fun.
Wow.
And this brings a sense of ease and comfort that although eventually we lost the patient, but they came back to say thank you. Like there was no sense of guilt saying that, oh, how I wish I was there. Because they were actually there. It's just good that we as women, we also need to prioritize ourselves. Because guess what? What you don't have, you can't give. And you should be able to have that sense of love and belonging of your own self before you can extend it to somebody else. So it's really quite a lot.
In fact, you're touching on so many things, right? Because a lot of time, I meet women, especially, and they just, you won't even know some of them will just break down and start crying.
Right.
I'll just ask them, oh, so how is daddy doing? Or how is, how are you doing? And they would just break down. and start crying and say, listen, I'm burnt out, I'm tired, I'm exhausted, it's too much. And it's because we haven't, there's this sense of ownership, like you said, of, oh, I need to be the one doing everything. But even just using the service, for example, as a stopgap, right? To say, let me just use it for this period while I, make time for myself or for my family, or while I take a vacation, or while I focus on my work or my project for a little bit. I want us to talk about the impact of, I just feel like there's no real, like you said, there's no real structure, there's no real solution around elder care in Nigeria. And we have a growing need, right? So Nigeria is on track to be the third largest country in the world in the next 15 years. By 2040, we will be the third largest country in the world, which means we're going to have more babies, more children, a young population. I think it's about 80% of our population right now that is already the youth. And so how is that impacting families? The lack of structure around elder care. If this is a business case, for example, if this is a case for our government, what is the real impact, and is it measurable?
It is measurable. That is, if there are actually variables in place that we are measuring. If there is nothing to measure, there is nothing we can do.
Correct.
And without the data, we can't defend what we're saying.
So there's a shortage of data.
So there's shortage of data, absolutely. So we don't have the data to show that this is what the problem is. And if there is, maybe we still need to do more of our own research. We know that currently we have about 3.5% of the whole population of Nigeria to be elderly, and that is going to double in the next 10 years. And when it doubles, trust me, no one person or not even one government can actually support that massive number of, need. And again, you would agree with me that with aging comes so many other things, comorbidities,
correct,
and all of that. And we need to also make plans for that. So the impact on the family, it may be something we don't see now, but it is like a doom waiting to happen. And we need to be very intentional and begin to actively promote, create awareness about care support for people.
Is it just care support, or even maybe formal nursing homes, or we find aging homes?
Absolutely. So I was even going to say that it's not even just about getting the provision, it's even now creating awareness for the youth to also be interested even in care. You would agree with me, or if you don't know that, even in the Nigerian Care Act or something like that, if we do have, there is a provision
we do not have a care policy.
I think we do.
We have something around child care.
There's something for
aging parents,
for aging,
for elderly,
and even palliatives for cancer, management and all of that. So the impact on the family is enormous. One, and I think it needs to boil down. So I was talking to somebody today, and the question of, do you even think organizations can see the importance of care support for vulnerable people?
That is corporations?
Yes. So do you even think, like, if I have a staff working with me, why should I be bothered about her mom? That is a question. I'm like, you should be bothered. Why should I be bothered about her mom?
Yeah, that is something that, shout out to one of our partners, Providus Bank, because they provide some sort of stipend to their employees.
Yes.
To support elderly care, expenses.
Very good.
So how do we plan for this future, right, that is coming for us? Because it almost seems like, I feel like you and I and a few others are the only ones screaming and yelling off the top of our heads about the current crisis that we have. And I don't think, like you said, a lot of people don't understand that it's a crisis. I think it's because of the economic crisis and the culture that we're not seeing that this thing is it's going to land very hot on our head very soon. How do we dig ourselves out of this? What are some of the solutions that you think is low hanging for us to start plucking?
See, I don't think anybody can do anything in isolation. There has to be a lot of discussions around care, a lot of discussions. It's not even a one size fit all. There has to be a lot of policy improvements. Is it improvement or even creation? You have to design the policy. You have to create a use case for it, and then put it into perspective. Then people need to begin to think more about awareness, campaign. We need to keep putting it out there, because the truth is, it is what people see that they begin to understand. In fact, I mean, there's one of this great guys out there. I can't remember his name right now, and he uses his platform to promote health education.
Apropos doctor.
Apropos
I
doctor,
love him.
yes.
We're trying to
You
get
know
him.
my
Apropos
guy.
doctor, if you're watching this, we're trying to get him to come on the show.
Oh my
Because it'll be
God.
great.
I'll probably mention it to him. We need to begin to tell people about why care support is
So important.
so important.
And I don't know if it was you that I was talking to, because the state of care for our elderly ones in Nigeria really bothers me. I don't know what it is. I've not been, knee deep into the healthcare system here. I'm not going to lie. But the two experiences that I've had, because I always tell my husband, I said, it's so important for our parents to age with dignity and respect. And it's something that I fundamentally believe in.
I, for one, if I'm going to employ someone in my house to work with me, he would get the basic training of care, and then that way we now are on the same page. We have fairly enough understanding of what is expected of you to do as an employee and what I'm expected to give as an employer. So yeah, that's some of the things that we offer.
So I think it was, I'm not sure who I was speaking with a couple of weeks ago that was talking about, elder daycare. Because we always talk about childcare and childcare centers, and the person said, "Oh, that there's this new idea, or there's an idea that somebody had brought up, about elder daycare, or even because there's nursing homes where we can take. I don't think we have in as much formal nursing homes in Nigeria, because there's this concept that you're abandoning your parents when you put them in nursing homes.
Interestingly, I like where you're going with this. So most times when we have a patient, we suggest it to them that, would you like to, have your parents maybe attend some daycare services? And then the word daycare alone is upsetting.
Because they
Some
think
people, they be like, daycare, would they take
infantilizing?
Yeah, like, why you...
But it's just day and care.
Do you understand? So the choice of words is also important. The way we communicate to people, because there is the culture that is ingrown in us. Like,
correct.
This is who we are. This is how we take care of people. My auntie, the auntie of the uncle, or the uncle of the brother or the sister will come and you get what I mean? Now, you now want to tell that person that, no, you don't need to be in the company of these people. You need to come to a daycare center. So we may not say daycare center. We will use, something very relatable to them, that, you go to clubs now, that they used to go and see his friends at the club when they were young, they sit out together over a couple of drinks. So can you just come out for maybe midday drinks with a couple of people? And then they would then resonate with that. So communication regarding care is also very important, and how we tell these people. I've had people that we suggested to them that we recommended a care home because we realized that some clients will need change of environment. They don't just want to be in one place all the time. That even reduces, the kind of, it discourages them over time. Like, they just feel tired and worn out and overwhelmed, and just having a breather outside of the home environment makes a lot of difference. So having them change environment, would you like to go to a care home? God forbid. And then I understand, because the condition of care homes in Nigeria, the ones that we know that are, owned by, I don't want to use some certain names, can be very discouraging. You wouldn't want to, even there are some hospitals that you don't even want to go, because you're like, I can't bring my parents here, or my loved ones. So we need to talk more about that. We need to begin to sensitize people about having care close to home, not necessarily in the person's home, but somewhere around. Some people, I have friends that want to bring their parents away from the village to Lagos or to wherever, and said, I just want them close to me, but they may not get the right care at home. But maybe if there's a place they can go and be comfortable, but I know a couple of these things do exist. I have a couple of friends that own care facilities for elderly people, and I'm happy to, connect you if you're
Yeah, so
interested.
we'll definitely share some of those resources
Yeah.
in the show notes. But I love the idea of, localized care, like you said, because I think that as the population gets larger and larger, I mean, we're already a big country.
Of course,
We
yeah.
already need localized care as it is right now. And we see that our elderly parents are, unfortunately, just I think a lot of them, I don't know. I mean, I've lost my dad, and we've lost my father-in-law and my mother-in-law, so it's just my mom. But when I look at the environment here in Nigeria, it almost seems like a lot of them lose hope. Maybe because their kids are not here. What advice do you have for our diaspora families on how they can support their aging parents back home?
First of all, there's the issue of security, right? So a friend of mine called me from the UK. His dad passed on last year, and the mom has been with them, and she has to come back to Nigeria. But guess what? She's going to be alone. So all the imagine being alone. She's going to age quickly. So I told him, I said, see, you can't afford to keep her alone. We have to design care around her. Do you understand? What are those things that she values? Spirituality, a church community. We need to be able to build a community around our loved ones. Community, friends and family, care support.
Why is she coming home to do what if her
Because
husband has passed away?
it doesn't. Well, it is individual preferences. There was a time before my grandma passed on that she goes on holiday to the US and she's always crying to come back. You'll be wondering that why.
That's
But
my
that
whole
is it.
family.
It happens.
My whole family. My father will be like, listen, buy my tickets. Buy my tickets. I'm coming to America.
It is just
He will even tell you, buy it
natural.
for 3 months. Wait, buy it for 3 months. Why did you only do 2 weeks? Change it. I'll change it. My father will land.
In 2 weeks' time.
Is it as soon as it's 2 weeks like this? It's not
Tired.
people.
Yes.
Nobody. Where are my friends? I've not seen anybody. I'm calling them. Nobody's picking up. He wants to go back home.
Oh my God. But you see, that is the thing. Home is our heart, and home is what people are used to. You see many people relocating back to Nigeria at a certain age, but they just realize that wherever they are is no longer being ascribed as home to them anymore. They no longer have that passion for it. They feel like there's a home somewhere that they have to go and settle. So they want to come back to their first love. Even in developed countries, Western world and all of that, for anywhere you hear care support, caregiving and all of that, they have communities. So these are the communities that you can always easily tap into. So my care stand has a community that people in diaspora can tap into. You would have a community that people in diaspora can tap into, depending on the service that people, require. So when they tap into that community, it's easy for them to say that, okay, are you coming to Lagos? Where are you staying in Lagos? Oh, these are the facilities that you probably you need to connect with. So all these directories, they're easily accessible out there. I think people need to begin to also look into that for a country like Nigeria. Then lots of investments also needs to come into caregiving.
Care.
Yes, we need to see it as, the future. The government, they're actually trying to invest in healthcare, but, at a tertiary, level or, but at the primary level, especially for elderly people, there's still more work still needs to be done.
A lot of work.
Yeah,
a lot of work. And I love what you said about investing, because that is where there's a huge gap.
Yeah.
Whether it's private investment or public investment, there's a huge gap because people still don't understand that there is an economy, that the care economy exists.
Right.
Everybody's aware of agriculture, everybody's aware of fintech, everybody's aware of all this, other industry. But we need to start looking at the care economy and say, how do we elevate care? How do we build a care infrastructure that the country can rely on, right? Children can rely on childcare. Our aging populations can rely on aging care, on elder care. Our disability population or persons with disabilities can rely on that care, and we can train a workforce that understands how to care for these people, a workforce that is treated with dignity and respect. These things, it's an ecosystem.
Right.
And, like I said, people like you and I, we are attempting to just make sure that everybody understands this. But I think it also boils down to, as an individual, because if for those that are listening, as an individual, what can you then do? I think the first step is valuing care.
That's it.
So many people, I don't know if you get this, but people will call us and say, I need childcare, I need a nanny, I need this, I need that. And me, I'm even always like, I don't run a childcare, I don't run an elder care facility, but I'm looking at more of the ecosystem. And I always say, what's your budget? It's 50,000 naira or 30,000 naira. And the person should be able to work from 7 a.m. to clinical.
They don't want living. Someone that will live in the house as well.
That's what they want.
Yeah. So you see, that's the thing.
You know, after all, I'm providing bed.
Feeding.
After all, I'm providing food. So there's a whole bunch of, and that just shows, that we're not valuing this work.
A lot. And I mean, I wouldn't blame anybody because again, care is perceived as the lesser or the weaker. You get what I mean? Chain of care support. Just the way women are seen as, some women are seen as, just be the wife, take care of the home, you can take care of the family.
But is that why we don't value care?
Because
majority of the people that have historically provided care are women.
You see, that is the thing. So my mom is the main carer, the main carer. Yeah. My grandmother was the main carer. So it just becomes a norm that you also should be the main carer. But there's no problem in being the main carer. But we can assign duties.
And actually value it.
And value it.
Because when mommy or daddy falls sick, the first person they will call is one sister somewhere.
Yes.
But nobody's calling the men to say, leave your job and come and take care of daddy.
But honestly, truth be told, I've seen fantastic men.
I'm sure.
Would jump over a cliff.
My brothers took care of my dad.
They would jump over a cliff to care for their parents. In fact, they wouldn't mind doing it. But we are the ones that still remind them that, sir, you need help. You need support. This is not a one-man job. You'll be overwhelmed because you find out that people don't know that this care thing is so serious to the point that you will lose focus if you are not what's the word now? If you are not methodical about how to go about it. Because the things you're supposed to do, you find yourself not doing it because you have put aside the most important part of yourself to care for somebody else. And before you know it, bitterness is going to enter. Resentment will enter. Entitlement, and then you begin to see yourself as, I'm the only one, I feel abused, I feel used. Can we just save ourselves the burden of all of that and live in good health by getting the right care, the way you want to be cared for, the way you want to be, and then design and tell the people that, this is how I want my parents to be cared for. This is the routine I want them to follow every day. This is how they've lived their lives. This is how it should be. And then when you do it that way, we assess it, can we tweak this? Can we tweak that? That is why people go to school to learn. That is why we're studying healthcare, we're studying nursing, medicine. If it were not so, everybody can be a doctor, everybody can be a nurse, and vice versa. Right? So it is important that we need to place value on care. And to place value on care is to place value on oneself. There are many women and even some men living in denial of that. So they carry the front of, I can do it, I can help, I can do it. But inside they are embittered. They feel like the burden is too much on them. But the truth is, all you just need to do is to just say, I need additional help. And truly, most of our clients, that is the angle they come from. We've been doing this for a very long time by ourselves. Right now, we feel we need this care. We need this support. We need somebody to come and help us. And we help them to understand that, you need the right people. You need the right people to do this for you. That we will give you people that will support you. But don't expect them to be like you. Nobody can be like you for your mom. So that grace of valuing people then comes in to treat people with respect. And don't just say because they're caring for your mom, you then begin to treat them brashly. Because we've had cases like that.
Our people are badly behaved. Don't say we've had cases. You've had multiple cases. Our people are badly behaved. The minute they see that somebody is a helper, especially when they're helping the elderly ones, I think the minute they see that, it's like anything goes. The insult starts, the lack of, the disrespect. So I think that it's something that I hope that, on the home front, we start to do differently.
Yes.
We start to really embrace this idea that care is a life skill.
Yes.
It is a technical skill. It's a professional
I
skill.
even tell people it is a universal language. Everybody, like you say, everybody is capable of care. Everybody is capable of providing, and in your own strength, not necessarily in your weakness. If you know what you're good at, focus on it. And if you think you need to outsource, please do so. Outsource this thing so that you're not emburdened and then embittered to provide the right care for people.
Well, thank you so much for coming on the
show.
Even though we had to drag you sharp, but you came and you delivered.
You're going to cut that part, right?
It's not cutting anything. Don't cut this part. You came and you delivered. Thank you so much.
It's my absolute pleasure.
Really, really appreciate you. I can't wait. I feel like this conversation, we need to have more and more of these conversations because a lot of time we push care is always the last thing on our list in terms of who is actually going to do the work. We know we need it to in order to go get our work done.
Yeah.
Right? We all need care at some point in our life. I want to say at every point in our lives, whether when we're born or throughout our lives or even towards the end of our lives, we need care. So why are we treating it as an afterthought? Right? It's something that should always be priority for us, for our family. I want to say even for our churches and our institutions and our government.
Do you know that in developed countries, they begin to consider a patient for care right from admission at the emergency unit or at the or with the GP. So it is not, like you mentioned, it's not an afterthought.
No.
So a client comes to the hospital, a patient comes to the hospital and there's been a challenge, From admitting the patient into the hospital, you can already tell that this patient from here needs either caregiver at home or a care home or a rehabilitation center or a daycare.
Wow.
Yes, it is from admission. So from admission, this planning has started. But
we don't have that here.
It is an afterthought. So people would say, "Oh, my mom's just been discharged. I need somebody that can first start tomorrow." You know that. Then there's that sense of urgency.
Something that we should have been planning. Those are the issues.
Yeah, and then more companies, more corporate bodies need to begin to consider care. I mean, for their staff.
Absolutely.
Yes, especially if there are some people that have children with learning disabilities. And you won't believe it. The data that I have is that about 76 million children or people in Nigeria are living with one learning disability or the other.
Absolutely.
76 million out of 200. What are you telling me?
That is a lot. That's 40%.
40% of the whole population. What? You know, so even
you can tell. I look at some people like definitely undiagnosed ADHD is going on here, right? Like the way they will, you just be like, this one, we need to get checked. But we're all living with that, and we wonder why our society is not operating, at the optimal level when our people we're not getting the care that we need in Nigeria. That's the honest truth, because you will see a lot of folks and you'll be like, we know that this thing, even with just medication. I think I saw a lady that you could just see the depression written all over her face, in her movements and everything. But then that is the state of a lot of people in Nigeria right now. Whether it's the economic condition that has overpowered and subdued people, you just see that like heaviness around them. And again, we need care now more than ever. That is just the honest truth. We need care now more than ever for our children, our aging families, even our men. Even our women, postpartum care. That is something that we don't take seriously in Nigeria. The woman who give birth like this is like bye-bye, because we think that there's an omugo somewhere. There's no omugo anymore, because even our mothers need to work now.
Exactly. And I tell people that we all say that we want our parents to live long. It is by caring for them like this. We hear a lot of people in the developing countries say that they lived over 100 years or 120 and
Those ones are resources.
Yes, the resources are there. The investment is there in healthcare. So I just think we already have the template. Somebody just needs to take up that course here in Nigeria.
Our government needs to step up.
Somebody just needs to private. Yes, that public-private partnership needs to be amplified.
Absolutely.
Yes, for care to be something that we now are more interested in, more passionate about. more invested in. Yeah, because
if somebody wants to get into the care business or into this elder care or come on as a caregiver, because I just imagine that we have a lot of young people with no jobs in this country. This is a growing space. This is a space where I imagine we're going to have more jobs.
Right.
We need people to train to become caregivers. If there's a young talent out there that is like, wow, this is something that I'm interested in, how can they get started?
So the best way to start is first you have to do your know your literature, do your feasibility study. I tell people that the why is as important as the how. So you want to know why you want to do something before you start it. And I tell people again that you start from the foundation. It is good for everybody, whether you want to start as a business of owning your own care organization or you want to go to maybe becoming a doctor or a nurse. It's very important that they have that fundamentals in caregiving, right? And we do that in my care system. We train people. Interestingly, some of the people we've trained have relocated abroad. Some of them are taking courses in nursing. Some of them are taking courses in health and social care. We have one of our members, I'm very proud of him. His name is David. He's currently in the UK and relocated just a couple of years ago after I took our training. And now they've given him even senior positions because he didn't just stop as a caregiver.
Wow.
He found opportunity to improve upon himself and is better for it. And he's one of those testimonies that we have of the things you can do with caregiving. We tell people that, see,
so there's a career path.
Yeah, there's a career path. Yes. So majority of our students started off with BSc. They had maybe degrees in economics, architecture, banking, and finance. I'm telling you, we're like, what are you doing? Well, yes, because some of them want to change their career path. Some of them want to, explore other opportunities abroad. Some of them want to, just say they're doing it for their family. And I tell them that I'm glad you're doing this. Don't just stop here. There are many more opportunities out there. So just start with this, get the basic training, and then begin to impact yourself, learn, develop, and all of that. It had its downsides, you would agree with me.
Oh, of course.
Because yes, caregivers come and complain about the way they were treated, and all of
it's
that.
always
so
the way they are treated.
we always have to guide them, help them to, to see themselves in a way that they don't get really downcasted or discouraged to say they don't want to continue. So if we notice that there's anything like that, we do the necessary things. We have policies in place. We do all of that, and then we just help them move forward.
Wow, thank you so much.
Thank you
coming.
once again.
Thank you once
See,
again.
we never stop talking.
We
Pick
never.
up another question.
Let me just stop here. Let me just stop here before we continue. Bye for now.
Thank you.